A normal full-term pregnancy lasts 40 weeks. However, it can last anywhere from 37 and 42 weeks. There are 3 trimesters to it. Each trimester lasts roughly 3 months and lasts between 12 and 14 weeks. Each trimester brings with it its own set of hormonal and psychological changes, as you may already be aware. The unknown is often the source of pregnant anxiety. The more information you have, the better you'll feel. Let's take a closer look at the stages of pregnancy and what to expect. But before we get started, be sure to subscribe to our channel and ring the bell to get notified about our latest videos. First trimester. The first trimester of pregnancy lasts from the 1st to the 12th week. Pregnancy dates begin with the first day of your last normal menstrual cycle, and conception occurs in week 2. Although you may not appear pregnant during the first trimester, your body is changing dramatically to accommodate your growing baby. Hormone levels change a lot. Your uterus begins to assist the growth of the placenta and the fetus. Your blood supply expands to carry oxygen and nutrients to the developing baby, and your heart rate rises. The first trimester is critical for your baby's development. The baby will have formed all of its organs by the 3rd month, so this is a critical time. To help avoid neural tube abnormalities, it is critical to maintaining a nutritious diet that includes an adequate level of folic acid. Avoid smoking and consuming alcoholic beverages. These practices have been related to pregnancy problems and newborn defects. Miscarriage is a real possibility throughout the first trimester. If you take prenatal vitamins and avoid dangerous medications, you're already doing your baby a major favor and minimizing your chances of miscarriage. The first test you'll most likely take during this trimester will be an at-home pregnancy test to confirm that you're pregnant. Your first doctor visit should be 7 to 8 weeks after your last menstrual cycle. Another urine or blood test will be done to verify your pregnancy. Pregnant women should avoid deli meat and shellfish, especially during the first trimester. These dietary adjustments are thought to help reduce the odds of miscarriage even further while still keeping you healthy. Speak with your doctor about any diet changes you may require. The most important thing you can do for your infant is to communicate openly and directly with your healthcare professional about the decisions you're making and to listen to their recommendations. During the first trimester, consider pregnancy, delivery, nursing, and parenting training and register for them in your neighborhood or online. Second trimester. For the majority of pregnant women, the second trimester is the most comfortable phase. The majority of the early pregnancy symptoms will fade with time. You'll most likely have more energy during the day and be able to have a better night's sleep. As a uterus grows significantly in size, your abdomen will begin to seem pregnant. It's an excellent time to buy maternity clothes, avoid wearing tight clothing, and, if you're feeling up to it, tell your friends and family about your pregnancy. While the discomforts of early pregnancy should lessen, there are a few new sensations to become acquainted with. Leg cramps and heartburn are 2 common symptoms. You may develop a stronger appetite and your weight gain may accelerate. Work on gaining the weight that your doctor has recommended. At each appointment, go for a walk, eat nutritious, nutrient-dense foods, and discuss your weight gain with your doctor. Most pregnant women can feel their baby move for the first time in the second trimester, generally around 20 weeks. During the second trimester, the baby can hear and recognize your voice. During the second trimester, some screening tests may be needed. Discuss with your doctor any medical history, family history, or genetic concerns that may put you or your baby in danger. Doctors typically test for gestational diabetes during the second trimester. Between weeks 26 and 28 of pregnancy, gestational diabetes can be detected. You may be tested sooner if you have a family history of diabetes or if you have risk factors for developing diabetes. You will be instructed to drink a high glucose substance throughout this test. You'll have to wait an hour after consuming it before having your blood collected. This test will confirm that your body's reaction to sugar is normal throughout pregnancy. Third trimester. The third trimester lasts from the 28th week till your baby is born. During the third trimester, you'll begin to see your doctor more frequently. Your doctor will examine your blood pressure, urine for protein, fundal height, and hands and legs for swelling regularly. To monitor how your baby is preparing for childbirth, your doctor will also establish your baby's position and examine your cervix. You will be tested for Group B Streptococcus bacteria between weeks 36 and 37. Before sending your vaginal swab along for lab testing, a simple swab will be collected. During the third trimester, travel limitations are applied. It is recommended that you remain near your doctor or midwife in case you go into labor prematurely. People who are more than 28 weeks pregnant are usually not permitted to join cruise ships. Airlines, while allowing people to fly, suggest that you do so only with your healthcare provider's approval. The third trimester is an excellent time to learn about labor and delivery. The deadline or due date. Your due date is a delivery estimate, EDD. Even though you conceive 2 weeks or so after this date, it's dated from the first day of your last time. For women who have very regular menstrual cycles, the dating system works well. The dating technique, on the other hand, may not work for those who have irregular periods. If you don't know when your last menstrual cycle was, you'll need to have alternative methods to figure out your EDD. Because early fetal growth is quite consistent across pregnancies, an ultrasound in the first trimester is the next most accurate technique for establishing the due date. So guys, that was it for this video. What did you think about our video? Let us know in the comment section below. If you are new to our channel, be sure to subscribe and ring that notification bell to get notified about our latest videos. Thanks for watching.